Hi, this is the Peaceful Birthing Doula, Tanisha, and I want to talk about laboring. So, one of the things that everybody wants to do when they start laboring is they want to get moving, and they're told to go to the mall and walk and go do all these wonderful, amazing things and have fun, and that'll get things kicking. And that's fine and well if that is what you want to do, because most of the mamas are usually done with being pregnant by the time they get to 40 weeks. I mean, I've seen some that were done by the time they were 37 weeks. And that's fine. Your choice is your choice. But for those who want to figure out a way to do it without exerting so much energy, this is for you. So laboring is very strategic. It is really a mind over matter thing. But not only that, plan out, strategize. What should labor look like for you? So here's the one thing I want you to realize. Just because you're in labor doesn't mean it has to be difficult. Yes, is it going to be uncomfortable? For most mamas, it is very uncomfortable. Doesn't always have to be the extreme. There shouldn't be any suffering in labor. Shouldn't be. Keyword. However, when you're laboring, you're going to utilize your body to the best of its ability, but without exerting energy. So what I want you to do is to consider this. When you start labor, remember last video I said hydrate, eat good, get plenty of rest. But here's the kick. While you're resting, utilize the things that are easily accessible to you that do not require you to exert any energy. This is your bed, your couch, your pillows, those kind of things. Gravity is your friend in this case. You shouldn't have to work very hard because your body is already doing the work. That is what the contraction is doing. You don't have to help your body. Now, some mamas do need to help their body, but for those that do not, and you won't know it until you get into that situation. But sitting up, crisscross applesauce. That is sitting straight up with your legs crossed, pulled back, opening up that pelvis, creating a beautiful inlet so baby can come all the way down, put that pressure on that cervix to thin it out, and baby can start making its way down, right? That's the goal. So sitting straight up, utilizing your toilet. And if any of my former clients are seeing this, they are probably rolling their eyes and having flashbacks. But the toilet is your friend. It may not seem like it loves you, but it does. It is so helpful because the goal is to keep the pelvis open. Let's keep the pelvis open. Laying on your side, sidelining with pillows, opening up that pelvis, also creating a beautiful opening so baby can come down. These are your goals. It doesn't require much. Take your time, get your rest, sit in good positions, distract yourself in early labor, have your partner there cuddling you. Oxytocin is also your friend. When you go to the hospital, if things slow down, they will give you Pitocin. Pitocin is synthetic oxytocin. Utilize what's natural and easily accessible to you. Love. So let's think about those things. See how you can strategize your labor. And of course, we'll talk about atmosphere and environment in the next video. Have a great day. God bless you.